Good morning, everyone. I am Dr. Vijeta, and today we are going to discuss history of gonadotropin. Let's start with the urine pregnancy test. Let's go back to 1927 when Ashim and Zondek discovered a substance in the urine of pregnant women which has similar activity as the gonadotropic factor secreted by the anterior pituitary, and they named the substance as prolen. So it has the similar activity as gonadotropic factor in anterior pituitary. Till that time, it was not known whether this substance is released from pituitary or it is released from placenta. Later onwards, it was found that this substance was released from placenta, not from pituitary. Let's discuss how Ashim and Zondak discovered the pregnancy test and how did they perform the pregnancy test. For the pregnancy test, they used female young mouse and they injected the urine of the women who are suspected to be pregnant. And they waited for 5 days, and after 5 days, they saw their ovary. If the ovary was congested, that is, there are hemorrhagic bodies because the pregnancy hormone will cause increase in the vascularity, or there are yellow spots due to the corpus luteum, then the woman is pregnant. If these are not present, then the women are not pregnant. So this is the red dots which depicts the changes in the ovary due to increase in the vascularity due to the effect of the pregnancy hormone. After the discovery of proline in the pregnant woman urine, which was used for the pregnancy test, in 1930 they took the urine of postmenopausal women, and in that urine they discovered gonadotropins, both urine and in blood sample. And they found there are two type of proline A, which stimulate the follicular growth, and the second type is proline B, which induce ovulation. Today the proline A is known as FSH and proline B is known as LH. This is the diagram showing the how the pituitary gland will produce two type of hormone, proline A, proline B. Proline A is now known as FSH, and this will stimulate the follicle, and proline B, which is known as LH, will cause ovulation and help in development of corpus luteum, and also in endometrium it will lead to glandular transformation of the endometrium. Let's come to 1930, where Cole and Hart described the gonadotropin in the serum of pregnant mares, which is known as pregnant mare serum gonadotropin, or PMSG. But it was of not much use because there is for antibodies formation to this product, and which will lead to neutralization of its therapeutic effect. Thus, it was not much used. Let's move on to 1947. In this year, Donines attempted to purify the menopausal gonadotropin from the postmenopausal woman urine. And this contained both LH and FSH like activity, and the product was named as Pergonel, which is derived from an Italian word means per gonadi, that is for the gonads. This picture in front of you, where you can see that many nuns are standing. So mainly the urine come from the nuns. Why nuns are used to produce human menopausal gonadotropin? Because there is an extra advantage, as the risk of pregnancy is nil, so the sample will not be contaminated from HCG. That's why the sample used from the nun urine is more advantage. 1948, it was not known whether the gonadotropin which is present in the urine of pregnant women is derived from pituitary or there is another source. In 1948, Stewart, Shannon, and Montgomery discovered that the gonadotropins are derived from chorionic villi of placenta rather than the pituitary. So that's why it is as it is produced by chorionic villi, the name was chorionic gonadotropin. In 1961, first pregnancy was achieved by using Pergonel, and in 1962, first baby was born by using the Pergonel. Coming to 1980, in 1980 we have urinary FSH and highly purified urinary FSH. This was known as Metrodin. How will we produce the urinary FSH and highly purified urinary FSH? We have already discussed this in the previous lecture, that was on gonadotropin. Let's recall this. If we remove the LH component by using the antibodies, thus we will get the urinary FSH. And by using the specific monoclonal antibody that will bind to FSH, we will get the highly purified FSH. In the next slide, we will discuss the flowchart. In this flowchart, this is urine and the human menopausal gonadotropin is there, and then we will use the antibody that will react with LH. So it will separate the LH molecule and we will get metrodin. Okay, that is purified FSH. And if we use the monoclonal antibodies that will bind to FSH only, thus it will lead to the formation of metrodin highly purified. So this will lead to the separation of LH as well as the separation of the protein component. This all we have already discussed in the gonadotropin lecture. So due to the increase in the demand of human menopausal gonadotropin, there is increased urine collection and the urine demand is on rise. That is, the urine required quantity which is required is increased so many folds. So this will lead to the development of the recombinant gonadotropin. In the next lecture, we'll discuss the history of recombinant gonadotropins and the recombinant gonadotropins. So far we have discussed these years and you have to fill up what happened in 1927, in 1930, 1947, 1948, 1962 and 1980. So this is your homework, fill in these blanks. Thank you for listening. I hope you enjoyed the lecture. Next lecture will be on recombinant gonadotropin.